Hey, podcast listeners. I am so excited to have a doctor of physical therapy on my podcast today. His name is Dr. Derrick Hines, and he has his own podcast that I have been hosted on, which was so lovely 2 years ago. Felt like just a few days ago. And his podcast is called the Pain and Performance Podcast. And we are both excited to today talk about the intersection of physical and emotional health. This is something that unfortunately, I imagine got broken into different segments, probably around the time of the Enlightenment or even prior to that, when the Roman Catholic Church would basically burn anyone at the stake who said they were a scientist but didn't sequester what they did into just purely physical, measurable, material science. And so that's basically what's been behind the what we call the sacred secular divide, or the physical non-physical divide, when religion and spirituality was basically fractured away from the physical sciences. And that's really what's been behind what's still going on today. And unfortunately, so many people go to doctors who are not trained in anything other than the physicality. And yet we can't create this artificial distinction or false dichotomy. We both, Dr. Derrick Hines and myself, see in our practices that you just can't do that. It doesn't work. It doesn't bring healing. So I'm super excited to have this conversation today where we're talking about what we've seen, what we've learned, our own wisdom, and can share this with each other and with all you listeners. So welcome, Dr. Derrick Hines.
Thank you. Yeah, I'm excited. This is one of those topics that I think we definitely don't have the training in school on, and we don't spend nearly enough time on the intersection, and that's a trickle down effect, right? Even just like through what our current instructors learned.
Yeah.
And what they feel comfortable teaching and understanding.
Yeah.
And it just gets perpetuated. So it's like, until we start to increase the conversation that these are not separate things. These are very interrelated. And
Yes.
to try and think that you are solely treating one and not the other is just so far away from even what the current research tells us. And where my initial focus, I'll give you kind of a fun story that I think will probably relate to something that many practitioners have heard. But I was at a conference. We track everything in my practice. We track like who patients are, what their outcomes, what was going on. And I was at a conference and we were kind of talking more about, as you would, regenerative therapy and stuff like that. And they were like, well, what's the big attribute that y'all see that changes outcomes? And I was like, that's a great question. Like, what's the thing that separates the person who improved really, really well and the person who struggled to get better? And I didn't have a great answer. I really didn't. I kind of stumbled through it and went back to the practice and was like, guys, I want us to look at this. So we put quite a bit of the team on pulling a lot of the data that we had. And even as rough as our mental health assessment was back then, the biggest thing that showed a difference was someone's mental state whenever they started to go through treatment. That was the number one, far and above age, far and above like physical health. The severity of the problem was something that we thought would be involved in it. It was a bigger impact in telling us how well that person was going to create a positive outcome than any of those things. And so when that came out from our own data, we were like, all right, if this is the case, we need to start going through the whole staff. How are we addressing this? Because we can't call ourselves an innovative and advanced organization if we're not addressing the biggest attribute that we have to improve someone's health, healing, and pain.
Wow.
So that was where our kind of obsession with the mental and physical health cycle came from. And that's led to all kind of fun discoveries over the last 13 years or so as we've kind of been integrating that.
Well, let me ask you, how was the mental health status measured for that data?
So we would initially ask and just grade on a very rough scale, but we would ask a fear avoidance question,
Mm,
and we would ask a pain belief question. What does your pain mean to you?
mm.
And based on that answer, was there severe future implications to that? Was there moderate future implications to that, or were there minimal? So it was this. That's why I say it was even on a very rough scale.
So what's a
It still
pain
jumped out.
belief? Like what would a response be?
So a pain belief that would be severe is this is never going to change.
Oh, okay, hope. You're talking about
Yep.
hope.
Yep. This is never going to change. But then also, we've gotten more nuanced with this.
Yeah.
Also, if this pain is here and it means that I'm never going to be able to take my kid outside,
Mm,
that's severe.
mm.
If it means that I'm a teacher and I'm never going to be able to teach again, that's severe.
Okay, but still it's a metric of hope or
Yeah.
hopelessness.
Yes, for sure.
Okay, I
So that was how we
appreciate
were
that.
measuring it even back then. It was
Yeah.
very rough. It was based on
Yeah.
kind of the response to those two questions.
Well,
And
no, I'm
then,
so glad that you use those more what we call qualitative questions than doing like a quantitative, generalized anxiety disorder or, depression scale, because I think hope is the most important metric for healing. So fantastic.
it's funny you say that. So
Mm,
I've told my staff this a lot, and I don't know that I've ever said this on a podcast. People are like, "What do you like to treat? What's your favorite thing?" All these kind of things. And I've told people my favorite moment in healthcare is not when someone comes back and they're like pain free and like we haven't seen them for a year and they're like, "I just wanted to tell y'all how awesome this is." I love that moment,
mm,
but it's not my favorite.
mhm,
Somewhere in our first few visits with someone who's gone through a lot, when we're explaining the intersection of these things and we're explaining how they got there and we're giving them a path forward, and we create a pretty complex plan for them that gives them like, look, this is your playbook for regaining your control over your health.
mm, mm,
And we go through that. And when they get some momentum early, there's a time where they come in our office
mm.
and you see hope. You see it and like you feel it. That
Yeah.
is hands down my favorite moment in healthcare when I see that light start to turn back on for patients.
Mm,
And we'll many times we'll be a couple weeks into treatment. Like this is we're just starting to regain momentum and starting to do it. So it's not like they're coming there and they're saying like all this stuff is better, but they see a path and they see hope. And it's like many
mm,
times in that visit, they're tearing up, we're tearing up. It's like
mm.
we know that the future is going into a better direction. And when hope comes back in,
Yeah.
lots of things are possible, but it's my favorite moment in healthcare whenever that starts to turn back
Yeah.
on. I
Ooh.
until you said that, I haven't put that together, but
Yeah. Well, and you also mentioned, you have this game plan and you enlist them in that. And so that's also what we would call agency. And agency and hope, definitely have a very strong relationship. So empowering people through giving them hope, through them kind of taking back their own health, their own bodies, their own well-being into their hands. I mean, I couldn't agree more with what I see as a therapist is that is absolutely, what is going to make a difference between someone who's going to heal and someone who won't. Yes.
yeah, yeah, them understanding that and them having
Hmm.
most of the stuff that we talk about as like physical treatments are mental health treatments in disguise.
Hmm.
So when we look at um, take the most basic physical treatment, exercise. Exercise is a mental health treatment in disguise. If
Hmm.
you look at the studies around exercise, I would put the physical outcome studies versus
Mm,
the mental health outcome studies
mm,
next to each other, and you will see a bigger impact
mm.
on mental health than you will on physical health much earlier in the process. So if
Yes.
you look at this and you're like, okay,
Yeah.
What does it impact the most? It impacts
Right.
mental health
Right.
more than it does physical at a much more efficient rate. So you're like, is this a physical health treatment or is this a mental health treatment? And there's so many things that fall under that. And when we
Yeah.
started to realize that, like, we're talking to our doctors in our practice, and I'm like, whether they're recommending, physical treatments or anything, um, in the beginning, they're trying to build trust with their patients.
Mm.
And, so they probably are going to spend a little bit of time, just kind of working on that. Like, can they build their relationship so there's mutual trust there?
Mm.
But somewhere in there, they'll drop the line like, look, this is a mental health treatment in disguise. We're going to improve your physical health. We're going to improve your healing and your function. But it's
Mhm.
doing that in a circuitous way where it's actually
Mm.
improving the mental health first.
Yeah.
And there's so many treatments and therapies that fall under that guise where it's like,
Yeah.
these are just in disguise.
Well, when we think about exercise, it's really about, so I'm going to just kind of use my lens, the way I kind of read into things. So to me, engaging in exercise is healing your relationship with your body, with yourself. And, talking about these false dichotomies in Western culture, the mind body split is a real bad one, that we live in our heads and we dissociate from our bodies. And so the more we heal our relationship with our body through physical exercise, we're healing that rift. We're living in our body. We're loving our body. We're what I would call self-attunement, where we're attuning to our body. And of course, that's going to foster healing, because that fracture in the first place is, I believe, what the illness is, or, stems from.
Whenever I'm talking to practitioners, I think it even gets a little bit deeper than that. And some
Mm.
of this is teaching. Like, how do we teach the
Mhm.
interrelation? And that's hard. So
Mm.
in school, we break it up.
Mhm.
Like, we're like, okay, well, here's your humoral system. Here's your hormonal
Mm.
system.
Mhm.
Here's your cellular system.
Mhm.
Here's your musculoskeletal system. Here's your mental emotional system.
Mhm.
But then we forget, like, okay, that's fine. If you need the practitioners to understand how these things work, I get that. That's probably an easier way to teach it in the beginning. But
Mhm.
we forget in school to come back and say, like, okay, a tiny change in this one changes this one and changes this one and changes this one.
Yeah,
And a
yeah.
tiny change in this one changes this one and this one and this one. We
Mm.
forget to come back and say,
Mm.
none of these work in isolation. I know we taught y'all that,
Mhm.
but that's not how this works in the
No.
real world. These are all interrelated, and a tiny change, positive or negative, in one can positively or negatively affect
Yes.
all of the other ones.
Yes.
That can be a problem, right? If it is negative. If
Yeah.
you have a negative physical thing, it can affect our cells and our hormones and our
Yeah.
mental and physical health.
Yeah.
But where the superpower of the human body comes in
Mm.
is a positive change in one. The tiniest positive change in one
Mm.
can create momentum because it starts to elevate the function of
Mm.
all the systems
Mm.
that are intertwined in
Wow.
that. So that's where we can take something
Yeah.
like this that can be very frustrating for our
Yeah.
patients and say, like,
Yeah.
why, like if I'm trying to improve this, but this one's not functioning, it just
Mm.
shoots me in the foot. I'm
Mm.
like, but there's a very positive part of this where
Mm.
if we can make little bits of momentum in each of these
Mhm.
systems, they
Mm.
start feeding off of each other. And
Mm.
now, instead of this negative momentum that we get, where
Yeah.
negative mental health creates a negative pain response, creates an increase in cell inflammation and cell
Mhm.
reactivity, now we can go on the positive route where a
Mm.
little improvement in mental health and
Mm.
function and emotional resilience creates a much better processing of the physical body. So we're
Yeah.
doing more. So we're creating more healing. So we
Yeah.
have better hormone regulation. And now that tiny change
Yep.
of 1% improvement in mental or emotional regulation
Mhm.
creates an improvement in all those other
Yep.
systems.
Yeah.
And next thing you know, as long as we keep the momentum going, in 3
Mhm.
months, in 6 months, in a year,
Mm.
you're in a vastly different state, not in one system, in every system in the body, because of that interrelation and that momentum we can create.
Yeah.
So we try and teach this to them, like,
Yeah.
Don't let the frustrating part overcome.
Yeah.
Use this as our superpower.
Yes. Oh my God. Well, I just think, the body has a natural proclivity to heal. It wants to heal.
It does.
And so, of course, when we just make small alterations in mental health, the body's going to be like, yeah, okay, let's do this. And we forget that. That's another thing I think that Western medicine, I'm so I'll just be really honest. Not a fan of Western medicine. I had a home birth with my daughter. The last place I would have a birth is in a hospital for many, many reasons that I won't go into. I don't trust all the interventions of Western medicine. I think we have a bias in favor of, litigation that, we do all these interventions to not get lawsuits. And so I see that. But anyway, so present company, excluded here. But yeah. So what I was going to say is Western medicine, we forget, the body doesn't actually need that many interventions because it wants to heal and it has a natural healing proclivity. And, if we look at like an infection, all we need to do is keep that wound clean and free from, pathological bacteria. It's going to heal. Like the body will heal. We don't need a whole lot. And that's kind of akin to what you're saying.
Yeah, I've said many times that like the natural state of the human body is not in pain. Like,
Yeah.
Especially in our patients who've had persistent pain for a while. I'm like, your body, this is not what your body wants.
Yeah.
Your body, when we deal, I mean, this is probably a good thing for people to know. Like, so pain is your brain's output of a perceived threat.
Mm.
And it's there for our survival. Pain is not the
Mm.
enemy for you.
Mhm.
It is there so that we can get away from these perceived threats. The problem
Mhm.
today is that we live in this constant state of somewhat perceived threat. We have inputs coming from so many places that our brain does not know, for lack of a better term, what is a real threat and what is a perceived threat.
Well, yeah. And I will definitely say, and maybe you can speak to this too, Derek, is the brain will confuse past and present, the perceived threats. So I see this all the time. I mean, all the time with my clients. And I myself have experienced this where you can go through, what we call a trauma. And I don't really love using that word because we all have weird definitions of what that means, but something, a painful event. Okay. And it will trigger up past painful events that we haven't processed from age 3, from age 7, from age 15, what have you, unbeknownst to us. But the brain
Mhm.
is conflating those two things. And now we're feeling things in our body that we didn't feel before that we dissociated from. And so that's a big one. Can we talk about that? You seem like
Yeah.
you're on board with that.
This is
Yeah.
one of my favorite topics because this, like, the pain is in my head
Mhm.
idea has just gotten so misconstrued over the years. But my
Yeah.
favorite story around this, do you know who Lorimer Moseley is?
No.
Explain Pain, really good book.
Mm.
He has a story of he's from Australia, and at one point he's walking through the woods, he's walking through the bush, and he scrapes his leg, and he continues to walk, and he starts to kind of feel some throbbing in his leg.
Mm.
And he's like, that doesn't feel right.
Mm.
So he sits down and he takes a look at it. He was bit by an extremely poisonous snake.
Oh,
So now he's in survival mode, right? He's
yeah.
like, okay, I'm in the bush. If I don't get treatment for this as fast as humanly possible, I'm not going to make it.
Yeah.
And so he like goes into action. They get, they get a response team. They get him out of there. He gets to the hospital, and he's one of the very few people that survives this poisonous attack because most people are so far away from healthcare.
Yeah.
Fast forward a year. So like this is a major event. He was in the hospital. He's treated with tons of antivenom. So he's in the hospital. I think he said a week, but
Mm.
and so fast forward a year, and he's better. Everything's gone. He feels good. He's walking through the woods. He's walking through the bush, and he steps through a kind of thicket area, and he feels a snake bite him. And he was like, I fall down and it is the most severe pain I've ever been in my life. This is not a pain in my head I'm imagining. This is excruciating, leg pounding, the worst thing I've ever felt. We start calling, a snake bit me. I need y'all to come. We've got to go. And they take a look at it, and it was a sticker bush that got
No
it.
snake.
No snake. And he was like, okay, this is what our brain does whenever we feel this. It takes all of our past experiences. It takes our current situation. It takes the implications of our current situation. What does this mean about our future? And in an instant, it takes all that information and decides, do I need to tell you for our perceived threat survival that this is really, really bad, or do I not need to tell you? The first time, it was really, really bad for Lorimer. But his body's like, I've been scraped by sticks before. I've gotten sticker. I don't need to tell him that this is a major deal. And so when you say our brain gets confused by the threat, it takes all that information in and makes a decision about what signal to send you. So this is where our beliefs about, like, this goes back to in our practice when we're at, if someone told you you have arthritis and you saw your mother get wheelchair bound by arthritis and she's crippled, in that moment, any little thing that you feel that feels like arthritis, you interpret, your brain takes that in and says, okay, this means I'm not going to be able to function. I'm going to end up like mom. My future is permanently altered for this. And now this threat has just grown to this monster that we have to deal with. And your brain is going to respond in kind. That doesn't mean that it's,
there goes that hope that is so imperative for healing, because now you're hopeless because your implicit belief is there's no hope. I'm going to end up just like this, right?
Yeah. And so when we get there, I think people hear this and like, I hope it's enlightening that you realize like, this is not a pain in my head thing. This is not a like, oh, we just need to like, overcome that. These are real responses in the body. This is how we have survived all these thousands of years. Unfortunately, in our current environment, it doesn't serve us super well today. You have things that are perceived threats, that are online things, that are news things, that are your past history, that are articles you've read.
Yeah, I also just there's perceived threats, what you're calling perceived threats, but then there's just like life, and but those things that we experience, there's nothing new under the sun. So life, our current experiences will be somewhat echoes of the past. And when we hit those echoes and we haven't processed the past and we disassociate from those feelings the first time around, which most of us do, is we'll feel them again. So it's not even like just what we call perceived threats. So can I give you an example of my own life? So about 17 years ago, my husband and my daughter and I, my daughter was 5 at the time, we had to uproot our family and move about an hour and a half away. And for me, it might have been like at least the dark side of the moon. It didn't matter that it was only an hour and a half away because it was so lonely. I didn't know anyone. I didn't have a job. My husband, lost his job here, got a job there. So he was going off to work every day. My daughter's 5, so I put her in kindergarten. And I'm by myself all day. I don't know a single person. I have nothing to do. And I was just as lonely as I'll get out. And one night, one of the first few nights we moved, I look at my husband and there were tears in my eyes. And I don't know what I said, but I needed empathy. I just needed his eye contact to just see me and go, wow, I see you. I see how hard this is for you. And it's heartbreaking to see how lonely you are, something like that. And that's what I'm expecting. And I don't get that because turns out he felt very guilty for making me feel so lonely in his mind because he's the one who made us move in his mind because he lost his job. So he gives me kind of like a hardened look and he's like, get it together, you'll be fine kind of thing. And now my husband's a lovely person and we have since healed all of that. But in that moment, I was so triggered, unbeknownst to me. In retrospect, I see it now. But in that moment, me desperately needing empathy from an attachment figure, I re experienced something that I first experienced when I was 3 years old. And that was from my mom, and having to, be alone with her during a few months when she was incredibly depressed, and not having my grandfather present, who is very attuning and very empathic. And during that time, I must have looked to her for empathy and expected it, because I had a grandfather who was my primary caregiver, and he gave that to me, and she didn't. She, I believe, had the hardened gaze that my husband did in that moment, or in those moments. And so I re-experienced something that little Bronwyn at age 3 never was able to really feel or process. And so as a result, for several months after that, I found myself somatically very ill, and none of it made sense. And what I was doing is I was vomiting involuntarily at random times. I would be walking down the street, no joke. I did this several times, walking down the street, and I would just vomit. And it was so humiliating because people would see me and stare. I'd be driving the car and I would just vomit. I mean, just completely random. They made no sense. And the other somatic issue I had was I felt like there was a hole in my gut where I could not get full. And I went from a size 4 to a size 14 in like 2 months. I just could not stop eating. And now knowing, and I was not a therapist at that time. This is right before I went back to school for that. So now looking back and, working with my clients, I'm like, oh, the hole, the emptiness that I felt from having an attachment figure who didn't attune to me. I was feeling that emptiness. It wasn't food that I was trying to fill, it was love.
Yeah.
And then the vomiting, the involuntary vomiting, that's shame, because children have no objectivity to say, oh, my mom's got a problem.
Yeah.
This is not a reflection of me being deficient. It's a reflection of her deficiency. So I totally get that now.
Yeah.
But that's what I'm talking about. Like, so when you say perceived threat, I'm like, it could be anything and everything, not just what we would normally name as threats, right?
So you unpacked so many valuable things there. First of all, I'm sorry and I'm happy that you went through that, because you can now use that to change so many lives.
Yes.
Whenever I'm talking about this with patients and we talk about this, the often question that I get is like, all right, yeah, what do I do about it? And I don't know, at the time you may have just been going through this. We call this, I'm going to kind of teach what we give our patients.
Yeah.
We call this RID reprogram. So the first step, the R in RID reprogram, is to recognize the response. So like in that moment, when you have that response from him, recognizing that you feel an abnormal response in your body, that alone, like if people can just stop and be like, oh,
yep,
like that, I recognize that was something happening in me from some sort of a past history. We don't even need to put a name on it yet. We're just trying to recognize that is a thing that has happened and it's creating these symptoms. And so we'll have them like journal on this, recognize when you felt that. The second part gets tough. The I is to identify when you felt that before. Where in your history can you go back? And ideally, can you go back to the first time that you felt it, that you have an awareness of? It's so powerful. And I get why practitioners don't like to do this, because to do this it's not a fun thing to go back through all your stuff and find, I'm with you. I feel like the word trauma has been kind of bastardized, but and find this trauma that has led to this thing that you did not deal with. We stored this away because that was your only tool to deal with it at the time. But going back through and identifying, did I have a trust broken by a parent or by a loved one.
Yeah.
We go back to childhood a lot because it's there, but it's not always. Sometimes it's big relationships that broke down.
Yeah.
Sometimes it's just traumatic events, whatever it might be. Can we identify
Mm-hmm.
where in our history that has happened before? And then can we deliberately start the reprogramming process? So that's reprogram.
Mm-hmm.
The reprogramming part, our brains are really plastic with this stuff. Our
Mm-hmm.
brains can do a wonderful job of reprogramming how it deals with it if we start to give it the right direction and the right inputs. I love journaling for this because journaling takes a mental process and makes it physical. Even just the act of moving a pen, and this is writing down journaling. I'm like, I know we don't teach kids writing half the time anymore. I'm like, we still need to know how to do this because it can take the mental processes out of our brain and put them in a physical place. So a lot of times we will have patients go through and reprogram. Okay, here's what I felt in my body. Here's my response to that. Here's what my body's trying to protect me from. And here's a positive output of that. Like I'll give you a personal story on this where I realized how deep these things can be. I was speaking at a conference, and anytime I go and speak at conferences, I'm like, look, I'm a learner. I love to learn. So I'm like, I'm going to come and I'm going to be a part of the conference. I'm not going to show up and speak for an hour and then leave. And so for this particular conference, I was speaking on the third day. On the second day, they're like, we have a breakout session if you want to be a part of it. I'm like, yeah, that'd be great. And so they bring us all in a room and they lay us down and they take us through a breathing. This is their explanation. Hey, we're going to do a breathing exercise. And they turn all the lights off. There's 50 people in this room, 50 to 100 people in this room, and everyone's laying down. And we start breathing. And there's music and they're going through kind of some coaching with it. And my body goes into entire spasms. Everything is in spasms. And the guy comes up to me and he's like, are you okay? I was like, yeah, it kind of feels good. Like, it feels like I have a blanket over me. He was like, okay, I guess keep going. I'm like, all right, I can deal with that later. And a few minutes after I go into that, memories start come flooding back to me of not just one, but two significant traumatic events that happened in my childhood. That I had, if you had asked me, had any of these things happened before, I'd have said, no, I've never dealt with any of that stuff. Like I'm good. I'm well adjusted. I feel fine. And I got up from that and I was like, I was astounded that you can bury them that deep, that I would have bet you everything I had that I didn't deal with that stuff. And I sat up and like, I had the clearest, most vivid memory of it. And I was like, no, like this is real. This happened. So when we get to someone, and we do this with our patients a lot, who they're like, I don't know. I cannot identify this. I know it's not what I want. I recognize that I'm having a really negative response. And for them, a lot of it is, it's health. It's health related. It's what you were talking about. It's pain, it's food. And they're like, I just don't know where this is coming from. Then I think you have no choice but to get with a really good therapist that you trust and start digging. It's not the easy answer for anybody. And people come to us and they want to know, I need to get rid of these debilitating headaches or this, immune disorder or this autoimmune issue. They want the pill, and I get that. And I'm like, you will never truly have a handle on this unless we go back to why your brain keeps repeating this pattern.
Yeah. Yeah. And when you say autoimmune, so I train other therapists, and do you know what the word alexithymia means? No one uses this word yet. Yeah. So in psychotherapy, it's alexithymia is just a fancy way of saying holding it all inside, and literally without words is what it means, without words. So when we hold it inside our bodies, it doesn't go away. It causes autoimmune disorders. That's what so much research. It causes in children type 1 diabetes. It causes, which is an autoimmune disease too. It can cause, asthma. It can cause migraines, like you're saying, insomnia, vertigo, gut disorders. And so when you were talking about journaling earlier, I love journaling too, because what we're doing is having words. We're combating the alexithymia. We don't need to necessarily have words with the person in the moment, but if we put our feelings, express those feelings into words, that is step one. So yeah, all of that, just expressing
So good.
out of
I've
our
given so
bodies
many
these
patients
emotions that have been held
The
inside.
Artist's
Huge
Way.
stuff.
Are you familiar with that? By Julia Cameron, and it's a
been a long time, but
reprocessing,
yeah, the book
exercise in disguise of helping you tap back into your creativity. She goes through.
Oh, is it with your left hand? You're
she
supposed
goes
to
through
do stuff with your left hand.
A lot of what we're
what
talking about to tap back into your creativity. This is what she's trying to get you at. I'm like, this is therapy. She asked many questions. Like, one of the questions is, do you remember a time when you were really embarrassed? What did you feel? Who was involved? Like, get the picture down as clearly as you possibly can. She goes through, when was a time when you felt very proud of yourself as a kid? What was the earliest one? So it's a lot of these prompts that she goes through. And I've given it to many patients because it's very well structured. And I'm like, she's telling you to do this based on restoring your creativity. But we know through research that just doing daily writing processes improves our well-being, improves our mental health, improves our processing for what you're saying. Like, you're getting it out. Even like the Pennebaker protocol, where it's like no directions, write for 20 minutes, a few days in a row.
Yeah, I think that's all good. And kind of like you were, what's interesting though, I will say, I often say that our body is always speaking. So listening to our body, kind of like it sounds like what you did at this conference. You felt safe. Your body felt safe. You felt good, even though you were having seizures, but it felt like there was a blanket on you. It's like your body felt safe enough to express to you what it finally needed to, like what it had been maybe wanting to communicate for a long time, bringing that into, your awareness, your consciousness, and that was healing in and of itself. And so I think, words are great. But we can also disassociate with words. I used to journal. I was such a horrible journaler. I just tell myself how great everything was all the time. I was so disassociative. So listening to our bodies when we're feeling sick, when we're having the migraine, like, hey, brain, where's this anger? What's all this anger? Is this anger at me? Is this anger at someone else? Like, what is this? Help me understand. And that's the self-attunement. Hey, gut, why are you feeling nauseous right now? Like, is there shame? That's shame. What's the shame from? Is it even true? Does it still apply? Where did it first get lodged that it's coming up right now?
This is
just
where
starting that kind of dialogue
my excitement
with
around this comes from. Is like, you're having these conversations and getting this out there. And while it's still really restricted in healthcare, at least people are aware of it, and we're starting to have more conversations in healthcare on this. We are in the most infant stage of that. But if we can take our current breakthroughs with treatment stuff, and we can start to integrate that with these questions and give people a toolkit, now we're going back to what we were talking about before, where you're addressing the systems and you're using that positive momentum. Now we can get to where, like, we all have a way of pressing the button to improve our health, whether that's manifesting in pain or whether that's manifesting in other physical issues. We have a way of elevating the emotional response that's leading to the physical response, and we can treat the physical that in turn can affect the mental, emotional. That's my excitement about the future of these things. It's like, yeah, we've got breakthroughs in peptides and we've got breakthroughs in healing and regeneration and all this stuff. I think we're going to learn really quickly that those are all going to be superficial if we're not adding this part in.
I could not agree more. And yeah, what drives me most crazy is when I have clients being told by doctors it's genetic. And I'm like, have you heard of epigenetics? Like our environment switches on things or off. So you're making people feel hopeless, which is what they need most right now, is hope, by telling them this is, genetic. There's nothing they can do. Yeah, right now I'm going to have to take your word for it, Derrick, that there's hope within the medical field, because I have not seen that yet. But there is hope within the therapeutic world. I believe that. And just kind of among the general populace, because more people are starting to realize somatic stuff in their body, that their body is really important.
I hope,
and
my hope would accelerate from the healthcare world if we would start teaching practitioners the power of language. Saying that, you have arthritis and you're just gonna have to live with it. You have this disease and, there's nothing we can do for it. Doctors will say that because they're coming from a scientific mind and they're like, I read the study and it said that that's it. But then you talk to them and you're like, well, what if they started to get healthier? What if they processed that better? Would that not be, is there something we can do with that? Well, yeah, that would be better. I'm like, so what you just put on someone is hopelessness. I'm going to start using that. That's not been the word I've used in the past. You've just placed that burden on them, and that's your fault. That's not their fault. That's what you have given to them to carry. We need to start having more practitioners who know that. They understand that when you give a patient that, you're just now making them carry that burden that someone has to offload through working through it. When did you start to think this? When did you start to feel like this was going to last forever? Someone's got to handle the problem you just placed on them. So
that's right.
I am hopeful that comes. I think until we're teaching that in medical schools and therapy schools, that it's going to be a slow process, slower uptake anyway.
Yeah. But maybe it could be from the ground up, as we humans are less likely to go to Western medicine for things that we're like, wait, first of all, this is a body thing. My body's angry somehow, and Western medicine is just going to give me, their only options are pharmaceuticals or medical devices or surgery. Those are the three. That's all they can offer. And, maybe I shouldn't even go to them. Maybe they're the wrong person to go to for hope. Or if I do get a horrible diagnosis, maybe I shouldn't put so much faith in that, because maybe they are so limited in what they know. And I like to tell people, you're the expert on your body. It is your body. When the doctor lives in your body, they can be an expert on your body. But until then, you are the expert. And I think that comes back to self-attunement. We can't outsource attunement to anyone else, whether it's a chiropractor, whether it's a doctor, whether it's a therapist. We have to attune to ourselves.
When I first got out of school, I practiced in a chronic pain center in South Alabama. Not a lot of super healthy kind of cultural involvements in that area. I'm in South Louisiana now, so we're not a whole lot better, but I realized really quickly that doing exactly what you just said, doing medication and surgery and injections, was changing little to none of my patients' lives. And that drove me crazy. And so I started seeking training outside the country. I was like, we don't know what we're doing. I'm going to start traveling for this stuff. I'm going to go find who's the best doctors. And I trained for quite a bit overseas, but one of the trainings that I did, I spent about a month in Thailand training with some little rural, crazy intelligent doctors who had a degree in everything you could think, just lifelong learners. And while we were talking with our patients, they would bring them in and we would have these conversations with a patient. And for them, when you look at their healthcare, These people are not, they're not well off. Thailand spends, it was like 1/270th of our healthcare budget. And yet they have less chronic pain. They have less mental health issues. And when you looked at it, the doctors were like, look, they can't afford to go and take these medicines. We don't have access to these surgeries. So we have to address what we can. And that was we're doing it wrong. We're flipping it over and we're doing the injection and the surgery and all that. And when that stuff doesn't work, we're like, all right, go try this other stuff. Good luck. I have a lot of these conversations now to flip that over. Let's go back and rebuild your health foundations. Let's start talking about what are the things that are affecting you mentally and emotionally that you want to reprogram. Get with a therapist. I'll say it here. I think this should be a dentist. We go to the dentist a couple times a year to clean our teeth. We should have a therapist where even if you're great and healthy, you go a couple times a year and you get your mental, emotional state cleaned. You have a cleaning. How many issues would we be ahead of if we did those things? So that's what's out there. And this isn't fake stuff. This isn't us talking in theory. You see this in these countries around the world that don't have access to spending what we do, and they still get better outcomes because they're having these conversations and they're talking with their patients, because they're like, look, this is all I can do. I can't give them a bunch of meds that they're not going to take and they can't afford. So we have to actually address it from the inside. And guess what? It works better.
That works. That's fantastic. Well, Derrick, thank you so much for sharing. We need to wrap up. I wish we could keep going because I feel like this conversation could be another, hour long.
Check out the Pain and
tell
Performance
listeners
podcast. We
where
talk a
they
lot
can
about
find
this.
you if they want to hear more.
Bron, we're going to have to keep this conversation going. We'll have you back on here soon and dive into some of these topics deeper. You can go to derrickhines.com. We put a lot of stuff out on there. I have a book coming out here fairly soon, and it is a playbook for regaining control of your health. So there's chapters on how do you do this reprogramming stuff? How powerful is mental health? You can't regain control of that if you don't have it. So you can get all that information at derrickhines.com. And I try and put out a decent amount of information on usually Instagram and YouTube. So Derrick B. Hines is where you can go for all of those things. I tend to be the main one that pops up. So if you just search for those things, you'll be able to find it. And thank you so much for talking about this and your listeners. There is hope. You can get better. Find great people that you trust. Don't listen to the ones that are telling you nothing's going to change and nothing's going to happen. You can 100% get better. And you can live in a way where you're not encumbered by these restrictions, whether that's pain or whether that's just emotional distress. There's answers to it. Just keep going.
Yes. And I want to end with one mantra I've been saying lately. Hope comes from within.
Thanks, Bronwyn. I appreciate it.
So thank you, Derrick. I will talk to you in the future. Thanks, listeners. You're welcome.